Alright guys, so the very first question here is, what is the function of the heart? A. It gives oxygen to blood. B. It pumps blood to the entire body. C. It provides nutrients to blood. D. It generates ATP. The correct answer is B. So the heart pumps blood to the entire body. Number 2. Which of these regions contains the heart? A. Cervical region. B. Thoracic region. C. Abdominal region. D. Pelvic region. The correct answer is B. Thoracic region. So the heart is found in the thoracic or chest region. Number 3. Where in the thorax is the heart located? Mediastinum, pleura, peritoneum, mucosa. The correct answer is A. Mediastinum. So the heart is found in the mediastinum of the thoracic cavity. Number 4. The heart is located between which of these organs? Lungs, kidneys, adrenal glands, intestines. The correct answer is A. So the heart is located between the right and left lungs. Number 5. How many chambers does the heart have? 1, 2, 3, 4. The correct answer is 4. So the heart has 4 chambers, and these include the right atrium, right ventricle, left atrium, and left ventricle. Number 6. What is the thickest chamber of the heart? Right atrium, right ventricle, left atrium, left ventricle. The correct answer is left ventricle. So the left ventricle is the thickest chamber of the heart because it pumps blood to the entire body. Number 7. How many layers does the heart wall have? 1, 2, 3, and 4. The correct answer is C. So the heart wall has 3 layers. This includes the pericardium, myocardium, and endocardium. Number 8. What is the thickest layer of the heart wall? Epicardium, myocardium, endocardium, pericardium. The correct answer is B, myocardium. So the myocardium is the thickest layer of the heart wall. It consists of cardiac muscles that are responsible for the pumping action of the heart. Number 9. What chamber receives blood returning from the body? A. Right atrium. B. Right ventricle. C. Left atrium. D. Left ventricle. The correct answer is A. Right atrium. Number 10. Blood returning from the body is called oxygenated blood, deoxygenated blood, nutrient-rich blood, nutrient-poor blood. The correct answer is B. So the blood that returns from the body is called deoxygenated blood. Number 11. What chamber receives oxygenated blood returning from the lungs? Right atrium, right ventricle, left atrium, left ventricle. The correct answer is C, left atrium. So the left atrium receives blood that returns from the lungs. Number 12. Which of these is not a type of heart valve? Tricuspid valve, pulmonary valve, pancreatic valve, mitral valve. The correct answer is C. So the pancreatic valve is not a type of heart valve. 13. The mitral valve is also called aortic valve, bicuspid valve, tricuspid valve, pulmonary valve. The correct answer is B. So the mitral valve is also called the bicuspid valve. Number 14. The tricuspid valve is found between right atrium and right ventricle, left atrium and left ventricle, right ventricle and pulmonary artery, left ventricle and aorta. The correct answer is A, right atrium and right ventricle. So the tricuspid valve is found between the right atrium and right ventricle. It is also called right atrioventricular valve. 15. Blood from the right atrium flows to right ventricle, left atrium, left ventricle, pulmonary artery. The correct answer is A, right ventricle. So the blood from the right atrium flows into the right ventricle through the tricuspid valve. Number 15. Blood from the right ventricle flows to right atrium, left ventricle, pulmonary artery. The correct answer is pulmonary artery. So blood from the right ventricle flows into the pulmonary artery. Number 17. Blood in the pulmonary artery flows to left atrium, the lungs, left ventricle, the aorta. The correct answer is B. So the blood in the pulmonary artery flows into the lungs. Number 18. Blood from the lungs flows to left atrium, left ventricle, aorta, the body. The correct answer is A, left atrium. So the blood from the lungs flows to the left atrium. Number 19. Blood from the left atrium flows to left ventricle, aorta, right ventricle, the body. The correct answer is A. So blood from the left atrium flows to the left ventricle through the bicuspid valve. Number 20. Blood from the left ventricle flows to aorta, the body, right ventricle, right atrium. The correct answer is A, aorta. So the blood from the left ventricle flows into the aorta. Number 21. Blood in the aorta flows to the body, right ventricle, right atrium, left atrium. The correct answer is the body. So blood in the aorta flows to the entire body. 22. What chamber forms the apex of the heart? Right atrium, right ventricle, left atrium, left ventricle. The correct answer is left ventricle. So the left ventricle forms the apex of the heart. 23. The blood vessels that carry blood away from the heart are called arteries, capillaries, veins, lymph vessels. The correct answer is A, arteries. So arteries are the blood vessels that carries blood away from the heart. 24. The blood vessels that carry blood towards the heart are called arteries, capillaries, veins, lymph vessels. The correct answer is C, veins. 25. The arteries that supply blood to the heart tissues are called pulmonary arteries, coronary arteries, hepatic arteries, mesenteric arteries. The correct answer is B, coronary arteries. So the coronary arteries are the arteries that supplies oxygenated blood to the heart tissues. 26. The heart electrical system responsible for heartbeat is called cardiovascular system, conduction system, circulatory system, nervous system. The correct answer is B, conduction system. 27. The natural pacemaker of the heart is called sinoatrial node, atrioventricular node, bundle of His, Purkinje fiber. The correct answer is A, sinoatrial node. 28. Normal heart rate is 20 to 40 beats per minute, 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 140 beats per minute. The correct answer is C. So normal heart rate is 60 to 100 beats per minute. 29. What is the medical term for heart attack? Atherosclerosis, cardiac arrest, heart failure, myocardial infarction. The correct answer is D, myocardial infarction. 30. What is the primary cause of heart attack? Sudden shock, fear, blockage of coronary artery, stress and anxiety. The correct answer is C, blockage of coronary artery.